Practical Pharmacology, Lab 2, Drug Acting on the Eye. This picture demonstrates the routes of ocular delivery of the drug. The arrowhead illustrates the routes by which drug is put on the eye. This subconjunctival injection. This route, subconjunctival injection. The other one, topical route. The third route is intravitreal injection. Intravitreal injection. The fourth and the last pathway is subtenon injection. Subtenon injection. Cholinergic drugs. Drugs and ocular uses. There are many drugs and their uses on the eye. The first group, acetylcholine, carbachol, methacholine, used in the induction of meiosis in surgery and glaucoma. Second group, pilocarpine, used in open-angle glaucoma. Third one, physostigmine and ecothiopate, used in glaucoma. All these drugs are cholinergic drugs. Cholinergic drugs. Adverse effects of cholinergic agonists are: number 1, meiosis; number 2, salivation; number 3, sweating; number 4, bronchial constriction; number 5, vomiting and diarrhea; number 6, CNS side effect, which is in high doses occur with physostigmine and pilocarpine. Ocular side effects: diminished vision, I mean myopia, and headache. Cholinergic antagonists. In the previous slides we demonstrate cholinergic agonists. In this slide we demonstrate cholinergic antagonists, exactly muscarinic antagonists. Number 1, passive mydriasis, due to relaxation of circular muscles, as we mentioned in the previous labs in atropine lab. Passive mydriasis occur with cholinergic antagonists due to relaxation of circular muscle. Number 2, cycloplasia, loss of near accommodation due to relaxation of ciliary muscles. Number 3, loss of light reflexes. Loss of light reflexes. Increase intraocular pressure, which lead to glaucoma. Decrease lacrimal secretion, and in this case the eye called sandy eye or dry eye. Okay? Drugs and duration of action. Group number 1, natural alkaloid, and group number 2, synthetic atropine substitutes. Here in natural alkaloid we have atropine and scopolamine. Examples of are atropine and scopolamine. Duration of action of atropine demonstrated from 7 to 10 days. This means long duration of action. Scopolamine, which is hyoscine, duration of action 3 to 7 days. 3 to 7 days. Group 2 synthetic atropine substitutes اللي هم homatropine, cyclopentolate, tropic amide. Homatropine, duration of action 1 to 3 days. Cyclopentolate 24 hours. Tropic amide 6 hours. نستنتج من هالسلايد هذا وهالجدول انه long duration in atropine and the shorter duration of action with tropic amide. with tropic amide اللي هو شنو synthetic atropine substitutes. of refractive error. What are the side effects of cholinergic antagonist? Systemic side effect of cholinergic antagonist. Also, these side effects mentioned in the previous lab with atropine. Number 1, blurred vision. Number 2, tachycardia. Number 3, constipation. Number 4, urinary retention. 5, dryness of the mouth. 6, dry sandy eyes. 7, fever. CNS side effects occur in high doses or toxic doses: sedation, hallucination, excitation. Okay? What are the contraindication of antimuscarinic drugs? Contraindication: number 1, glaucoma. 2, tachycardia. 3, prostate hypertrophy in old patients. 4, constipation and paralytic ileus. These 4 situations absolute contraindication for antimuscarinic drug. Antimuscarinic drugs. Beta blocker. Beta blocker, as we know, classified as selective and non-selective. Non-selective beta blocker, example timolol, cartiolol. Selective, example betaxolol, beta-1 cardioselective. These drugs given topically as eye drops. Where used or when used in open angle glaucoma. What is mechanism of action? Acts on the ciliary body to decrease production of aqueous humor. بالنتيجة يقل intraocular pressure فتقل عندي الساين مال الجلوكوما. Advantage of beta blocker can be used in patients with hypertension, ischemic heart disease. Okay? What is the treatment of open angle glaucoma? الكرونيك وليس الأكيوت. chronic and open angle glaucoma. الobjectives عندنا بالopen angle glaucoma هو decrease production of aqueous humor. الobjective أو التارجت أو الهدف من عنده treatment هو نقلل إنتاج الأكويس هيومر السائل. شلون نقلله؟ نقلله باستخدام البيتا بلوكر. بيتا بلوكر الفا 2 اجونست. لاحظ هنا البيتا بلوكر والالفا اجونست، يعني الادرينيرجيك ينقسم لي قسمين، اذا على البيتا فنقول بلوكر، واذا على الالفا 2 نقول اجونست. اوكي. Number 3, carbonic anhydrase inhibitor increasing autoflow of aqueous humor. And number 4, prostaglandin.